Have you guys noticed anything about us all on air today? Here's a hint. Check out Mark and Greg's ties this morning. Kara and Tashara's tops as well. Yeah, we are all wearing red for a reason. Today is National Wear Red Day, and the idea really is to bring attention and awareness to heart health and to join in the fight to end heart disease and stroke. Look at these numbers for me. These are from the American Heart Association. Cardiovascular disease, the #1 killer of women in the U.S. And by the way, this is not an old person problem. Heart disease and stroke can happen at any time. In fact, 45% of women ages 20 and up are living with some form of heart disease. I want to bring in Dr. Tulika Jan, cardiologist at Texas Health Dallas. Good morning to you.
Good morning.
Dr. Jan, can you first explain what heart disease is?
So heart disease is a broad term, but in terms of our cardiovascular health, it refers to any problems with the structure of the heart muscle, the heart valves, or the blood vessels and electrical system. So this can lead to problems such as heart attacks, strokes, and congestive heart failure, which is a problem with the pumping problem of the heart.
And would you say that heart disease is more often the result of genetics or lifestyle habits?
It's actually a combination of both problems. So the genetics of heart disease is complicated, but our genes do not necessarily leave us doomed to a certain outcome. Our family history is just one factor that determines our health outcome or our heart health. So our lifestyle habits are very important, and attention to risk factor modifications and treatments do make a huge impact in our cardiovascular health. Some of the major risk factors that are determinants of our heart health are things that we know of: blood pressure, blood sugar, high cholesterol, and the development of diabetes.
So would you say that if someone has high blood pressure, high cholesterol, type 2 diabetes, that is essentially they have heart disease?
Well, hypertension or high blood pressure and high cholesterol, those are risk factors for heart disease, but do not necessarily mean that someone has heart disease. Diabetes is a different story. There's such a high correlation between diabetes and heart disease that we consider that as a heart disease equivalent. So the good news about these risk factors and these heart disease equivalents are that they are treatable. So these risk factors, if people seek attention from their doctors and undergo either lifestyle modifications or sometimes medications, if they undergo these treatments, heart disease risk can be reduced.
Dr. Jan, we see a lot of people living with heart disease and dying from it in Black and brown communities. Do you think that enough is being done on a local and also on a nationwide level to address this disparity?
So UT Southwestern, our medical center, our University Medical Center here in Dallas, is actually looking at this problem with the Dallas Heart Study. So in collaboration with other institutions, they have found several things. They have found that heart disease is underestimated in the Black community. They have also found that in our brown communities, that especially Hispanics and the South Asians have some of the highest incidence of heart disease. But access to care in these communities is a problem. So locally, the medical center has attempted to enter these Black communities and find ways to help these people. We have, for instance, visited community barbershops after they found that these communities are very loyal and visit these barbershops regularly. So they found that this was a good place, for example, to screen for high blood pressure. So they set up clinics in these barbershops to screen people for high blood pressure, identify undiagnosed and untreated people with high blood pressure, and direct them to healthcare. And these people continue to come back to the same barbershops and can continue kind of redirect their follow-up in these communities so they can get better care. But there certainly a lot more needs to be done in these Black and brown communities locally and nationally so we can reach these patients and so that they can have access to care.
Finally, I want to circle back to women. What is happening there? Why are nearly half of women living with heart disease? And does it have anything to do with heart disease during pregnancy or postpartum, anything to do with preeclampsia, gestational diabetes, etc.?
Yeah, those are all those questions kind of tie into why women have such a high incidence of heart disease. So very recently, there was a study of 30,000 patients that looked at patients that presented to hospitals with heart attacks. And they found over the past 20 years that while the incidence of heart attacks in men was decreasing, the incidence of heart attacks in women were increasing. And what they found is that these women had higher incidence of high blood pressure and diabetes at a younger age. More of them were Black. And these women also were not receiving treatments such as cholesterol-lowering medication, diabetes treatments, medications that decrease platelets in the blood vessel and keep them from clotting off, and medications called beta blockers, which decrease blood pressure and control the heart rate and decrease the stress on the heart. So really targeting these risk factors in these young women is probably helpful. Regarding pregnancy is a very complicated state. A lot of changes in the hormones and in the way our heart reacts to the pregnancy. Women can develop a condition called postpartum cardiomyopathy, where the heart becomes sick after they deliver. They can also develop something called dissections, where the heart arteries and the big vessels of the heart can dissect or become damaged. That's an emergency and requires urgent treatment, but is treatable if women reach the hospital in time. And there's also can be abnormal heart rhythms.
Dr. Jan, thank you so much. Yeah, I think it's so much of what you said is important. Know your numbers, certainly, and do take your medication that you are prescribed. Thank you so much for your time today.
Thank you for having me.
And you guys at home, for more information, you can check out wearredday.org for more information.